I'm Jessica Taylor, and I will be presenting my quality improvement project for Dr. Amelia Washington's Nursing 405 Leadership and Management Clinical Capstone course. So for my quality initiative project, my problem that I identified in my specific clinical area is our same-day messaging statistics. So my current system that I work for has a system goal that greater than or equal to 95% of patient-initiated calls and messages will be answered or resolved by staff the same business day that the communication is initiated. So after 5 o'clock p.m., it goes to the next business day, and on weekends, it goes to the next business day as well. So our current year-to-date measure for my department is 96.47. So from a year-to-date standpoint, we are meeting the system expectations of greater than or equal to 95%. But for the month of May, we didn't quite make the target goal. We had 93.8% communications were responded to same business day. And then for June, we had an even further drop and decrease in it with a 90%. So for my quality initiative aim and measure, I set my goal of greater than or equal to 96%. So I want the staff in the department to respond or resolve the patient's communication greater than or equal to 96% of the time. Those messages or calls should be being resolved in the same day, which is important because a lot of the communication that the patients send is sometimes time sensitive, sometimes it's emergent, and not responding in an appropriate time can sometimes have negative outcomes for the patients. So how we can get this done? I chose to utilize the aviation approach for CRM, which is Crew Research Management approach. And so what this model suggests is that through communication, workload management, proficiency, and teamwork, quality initiatives or measures can be improved. So communication specifically can be improved in something that can be completed by there being clear scheduling work expectations, clear assignments, clear responsibilities set, and then accountability and consequences explained if those set responsibilities and goals are not met. For workload management, there needs to be an even or evenly distributed amount of workload that's fair and realistic. And then for proficiency, the staff needs to be providing quality work. So that means they need to be responding in an appropriate time, but they also need to make sure that the responses for the patients are appropriate. So if you respond to a patient's message in a timely manner, but it doesn't address the concern or the question or the issue that they sent, then that kind of defeats the whole purpose of responding to the message. So the staff needs to be not only responding in an appropriate time frame, but the content of the response needs to be appropriate. So then for teamwork, which is pretty much the core and the foundation of CRM's approach, and it's that everybody needs to work together, everybody needs to hold one another accountable, and if there are any exceptions or anything that can't be completed, anything that can't be done, staff needs to make sure that that is communicated and they are all collaboratively working together towards the same goal. So how will we measure this particular information? So my current system uses an analytical platform called Tableau. Tableau is where they pull monthly statistics such as the same-day messaging statistics, patient satisfaction, quality metrics, that sort of thing. And so we have an administrative assistant that pulls these metrics monthly and provides our department with where we are year to date, where we are for the month. So the statistics will be pulled from, and the information is pulled from Epic because all of the calls that are generated by the patients or the messages that are sent through the electronic portal, those are all going to be pulled from Epic. And so that is going to help us to determine which providers are meeting our quality initiative goal of having 96% or greater of those communications responded to or resolved the same day. So in the event that the department as a whole is not reaching that set quality initiative measure or goal, the Tableau can drill down and provide information about what specific provider is not meeting that specific goal. So for instance, if the department as a whole is 92%, the manager can then drill down to determine which provider. So one provider may have been 100%, another provider may have been 80%, and so they can identify which specific provider is not meeting those target goals. And then what that information can then do is provide the staff that are assigned to working that specific provider's in-basket, provide additional training, and then also hold those individuals accountable, meeting with them to find out what is the issue, why the goal isn't being met, and helping them overcome any potential hurdles. So for my specific quality initiative project, I proposed that each month one specific staff member would be assigned to work in one provider's in-basket. And the reason that this is because when the information is further evaluated, it can be determined which specific individual essentially did not meet the target goals. And again, additional training can be provided, or any needed resources such as training and that sort of thing. So here is projected kind of a past, present, future where we are and where we're headed. So this is my run chart that shows where we fell for our May messaging statistics, where we fell for our June messaging statistics, and then July, August, and September, and then October as well, all going to be projections of what I anticipate will happen with this model being initiated. And so I'm anticipating that we will not only meet the system's goal, but exceed the system's goal and make it to our quality initiative goal of 96% or greater of those communications being resolved the same day. So how will this quality initiative project or initiative be evaluated? So again, the messaging statistics are going to be pulled from Tableau, and that's going to provide us with concrete, objective data that tells us whether we're meeting the mark. And so we're going to evaluate that from 90 days from the implementation of this quality improvement project. So when this is implemented, we're going to confirm that as a system, not each specific provider, or as a department, we're meeting that 96% or greater mark. If we're able to maintain meeting this mark consistently for 90 days, then it can be assumed that this measure is working, especially because prior to the implementation, we were struggling consistently for 2 months to meet those and trending downward, which is obviously not what we want to do. So we'll also be seeking feedback throughout the entire 90-day process. So meeting with staff to find out what's working, what's not working, what needs to be changed, if there are any unrealistic expectations, that sort of thing. And so again, I did set the quality initiative goal slightly higher than the system's goal. So maybe that may be something that staff may feel like is an unrealistic expectation. So that might need to be adjusted to meet the system's goal and not set it above. I really do think it would meet. They would be able to meet with consistent follow-up, implementation, and then additional support. And then overall, if this initiative is successful, I think what could be further evaluated is there a correlation between the increase of this particular statistic? Is there an increase in overall patient satisfaction? And that can be pulled from our Tableau as well, but that can also be pulled from the clinic CG-CAP scores. So overall evaluating, because if patients are having their messages responded to 96% of the time when they message, having it resolved that same day, then I would imagine that their patient satisfaction would also increase because they feel like they're being heard, they feel like they're not being ignored, and they feel like their concerns are being addressed in real time. And so for this final slide, quality improvement is the responsibility of, and the answer is everyone. Everyone is going to be responsible for quality initiative. Each small step moves everyone forward. And so, with everyone focusing on quality improvement, everyone putting their best foot forward and genuinely doing the best work that they can, we have the initiative to continue to move forward and to improve. This also gives us an opportunity to always be seeking what we can do to be better. So these are my references, which is our text for the course. Thank you.